what I'm going to share with you is some of the early results of the registry. And Innovasis has actually now sponsored a registry to really try and track the clinical outcomes as well as the radiographic outcomes of a large number of cases using the full spectrum of their antibody materials. So specifically the A-lip graft, the cervical graft, and both the PLIF and the T-lip graft. Let's see if I can...
I'm happy to advance for you if it doesn't work.
Yeah, thanks, Christoph. If you would go ahead and just advance the event. So here's the registry, and this registry goes through April of this year. And having said that, there are now over 1,000 cases in which the HA-PEEK, or 1,000 cases in the registry alone. And this is a mixture of ACDFs, T-lips, A-lips, PLIFs, and some direct laterals have now been entered into the registry. There are currently 28 sites in the registry, and certainly any of you are interested in taking a look at your follow-up and the results of this, you're also welcome to contact Innovasis and become part of the registry. We're looking at patient-reported outcome measures, including the osteoid disability for the low back, the neck disability, as well as some other disease-specific measures. So the rate of enrollment has really ramped up quite significantly. As of April, there were 443 total patients and over 600 levels. Now there are over 1,000 patients in the registry. You see that a majority of the early enrollment was in the cervical spine, as well as T-lips and A-lips and PLIFs. And now there are some direct laterals that have also been enrolled into the registry. Next slide. And again, just the distribution in terms of segments. Primarily, these antibody fusions are being used in the cervical and the lumbar spine. Next slide. In terms of numbers, the majority of these were single-level fusions, but some were 2, 3, and even 4-level fusions. Looking at the cervical arm overall, this is the results of the Neck Disability Index, and in this instance, the results are what we'd expect with regard to other HCDFs is a reduction of NDI scores by almost 50% at 6 months, with maintenance of those results over time. Go ahead to the next slide. And also good improvements of both neck pain and arm pain at both 6 months and 12 months compared to baseline for the cervical HA-PEEK composite graft. Next slide. Looking at satisfaction, overall, 96% of patients said they would definitely or probably repeat the surgery, and overall rates of satisfaction, again, were very high with the ACDFs. Next slide. Looking at the lumbar arm, we show you the numbers are slightly smaller but growing rapidly. Overall, the ODI scores improved by more than 50% at the 1-year follow-up compared to pre-op ODI scores. Next slide. And similarly, the BAS scores for both back and leg pain also increased quite dramatically. Leg pain improved by 70% at 1 year, and back pain scores improved by almost 60% at 1 year. Similar to the cervical spine, the levels of patient satisfaction were very high. 96% of patients said that they were either very satisfied or somewhat satisfied with the lumbar antibody, inter-antibody fusion. Next slide. And again, more than 90% of patients said they would definitely or probably have the same treatment again with the lumbar arm. Next slide. There were 2 adverse events. So again, part of the registry is to look at clinical outcomes, look at radiographic outcomes, but also to record the adverse events. One of the adverse events was that one of the cages actually fractured during insertion. This is something that I've not experienced, but there was one case, and this is something certainly I have had with traditional PEEK, and I haven't had the HA-PEEK fracture, and there was also a case where there was a pedicle screw fracture in a second case. So really 2 adverse events were reported out of over 700 devices implanted. So really this is an initiative sponsored by Innovasis to look at outcomes and to really create an audit of your own outcomes. It's a facile system that Innovasis has created to enable you to enroll patients into the registry and to input your outcomes data over time. And I think with this registry, as it gains numbers, we'll have the significant ability to actually do some research off of this registry, including perhaps some comparative studies comparing the HA-PEEK to some other alternatives. But right now, I think our early experience with the HA-PEEK is really quite impressive and quite positive.